Hello, welcome to the second installment of Ek Dose Gyaan, Ek Dose Muskaan. In this installment, the Gyaan portion is headed by the topic First Episodes and Decision Making Thereafter. We discuss first episodes of 4 diseases. First episode of gallstone colic, of acute appendicitis, of paroxysmal supraventricular tachycardia, and of generalized tonic-clonic seizure, and the important decisions that have been made after this. Let's take the simplest disease first. After the first episode of gallstone colic, what do? Simple. Advise surgery unless medical contraindications exist. Any colic occurring once means the second colic is going to come at the rate of about 10% per year, about 90% in 10 years. And every episode of colic can potentially have complications: cholecystitis, pancreatitis, obstructive jaundice, etc. So any one episode is enough indication for surgery. Also remember that asymptomatic gallstones detected incidentally on, say, sonography do not require surgery unless the gallstone size is more than 3 centimeters. So that much is clear. Simplest solution: gallstone colic, operate. The second disease, slightly trickier. The first episode of acute appendicitis. What do you do thereafter? We do know that more than 50% of cases of acute appendicitis resolve with oral or parenteral antibiotics without surgery. But remember, the incidence of perforation is still very high, enough to warrant surgery even after the first episode. After the first episode, you must operate an acute appendicitis within 36 hours. If 36 hours have passed, the chances of perforation are 20% or more. For every 12-hour delay, the chance of perforation increases by 5%. If the patient comes with, say, a microperforation or a phlegmon or an appendicular abscess and has come in late, especially after 5 days of onset of symptoms, then you will have to wait and do an interval appendectomy. So after appendicitis acute episode, mark your time, finish the surgery within 36 hours if possible. In a pregnant patient, surgery is a must. You can't say, okay, I'll give antibiotics, she's pregnant, does not want to get operated. You have to get a pregnant appendicitis operated. The third disease that we discuss, slightly more tricky, is the first episode of supraventricular tachycardia. As you know, the SVT will present with palpitations, with pulsations in the neck, with fainting spells, even with a frank syncopal episode. If the first episode presents to you, your decision is, do I ablate or do I wait? When I say ablate, I mean radiofrequency ablation, to be done by an electrophysiologist. And this decision making, of course, is made by the cardiologist. But for the basics, if the patient has had mild symptoms, has had no hemodynamic compromise like low blood pressure, has had no syncopal episode, then you can wait after the first episode of SVT. If the patient has had one episode, the second episode may never come or may come after years, and ablation therefore is not mandatory. If the patient has recurrent episodes, then of course ablation becomes more important. If the first episode brings with it low blood pressure or syncope, then you will probably decide to ablate and not take the risk. If the patient is in occupations such as bus driving, pilot, then you will ablate and not wait for the second episode. So now we have discussed first episode of gallstone colic, operate. First episode of acute appendicitis, operate within 36 hours. First episode of paroxysmal supraventricular tachycardia, ablate or wait. And now the first episode of a grand mal seizure. In an adult, after the first episode of grand mal seizure, we must do an imaging of the brain. An MRI is vastly superior to a CT scan. So do an MRI after the first seizure. Don't think that this can be idiopathic epilepsy and I will only do an EEG and get away with it. No, an MRI is a must. In older adults, an MRI becomes even more important because ischemia is probably the commonest cause of seizures in the elderly. An MRA may be required. In a young person or an old person, the decision making will be also based on whether the seizure was provoked or unprovoked. A provoked seizure is a seizure which is caused by an underlying factor which is sometimes temporary, sometimes permanent. An intracranial pathology like a vascular event or a tumor. It can be provoked by a metabolic event like hyponatremia, hypoglycemia, an infection like meningitis, by a drug like quinolone. So provoked seizures have a lesser recurrence rate if the provoking factor is removed. So the decision making about whether to give a patient long-term drugs, anti-epileptics, also depends on whether the seizure was provoked or unprovoked in the first place. An unprovoked seizure can recur 40% of the times within 2 years, which means that if the seizure was unprovoked, you should give anti-epileptic therapy. This is an area of controversy, but if the 40% recurrence rate is to be believed, which is true, you must give anti-epileptic therapy, even after a single unprovoked seizure. After a provoked seizure, if the underlying cause is removed, then the chances of recurrence are less than 5%, and therefore you can get away without giving long-term anti-epileptic therapy. So that is about the first approaches after a seizure. I hope you liked this Gyaan portion, and soon we go to the Muskaan portion of first episodes and decision making thereafter. Thank you. The first episode of love in today's youngsters is very much like the first episode of gallstone colic. It appears out of the blue, causes a lot of agony, often precipitated by a heavy bout of drinking, lasts a very short while but has a very strong tendency to rebound. हमारे ज़माने का प्यार क्या हुआ करता था? एक तरफ एक one directional love. Mr. and Miss meet and kiss, more kisses, Mr. and Mrs. मगर आज के ज़माने में hello, how are you या फिर hi, कुछ ऐसे शुरुआत हो जाए. Do you miss me? Will you kiss me? पल में प्यार यूं पर फैला है, और जब एक दूसरे से बोर हो जाएं तो कारण प्रेमी ये बतलाएं कि you are Virgo, I am Scorpio, कुछ जब नहीं रहा, okay goodbye. हमारे ज़माने में जफर का शेर पढ़ा करते थे. पहले प्यार का शेर था कि उम्र दराज मांग कर लाए थे 4 दिन. उम्र दराज ने लॉन्ग लाइफ मांगी थी, मिली थी 4 दिन. उम्र दराज मांग कर लाए थे 4 दिन, 2 आरज़ू में कट गए, 2 इंतजार में. कैसा इंतजार रहता था. राह तकते गुजरा था वो पहला प्यार. 4 लिमिटेड के स्टॉप पर अनलिमिटेड इंतजार. वो तो सफर का शेर था, मगर आज के डफर का शेर क्या है कि 4 दिन कटते हैं यूं, अब इश्क के फसाने में, 2 उसे पटाने में, 2 उसे भुलाने में. एक दिन मेरी बेटी आकर मुझसे कहती है, डैड आई हैव अ बॉयफ्रेंड. मैं खुश हो जाता हूँ, पहली बार बॉयफ्रेंड हुआ है. मैं उसे कहता हूँ, यार यू आर इन लव. वो घूर कर देखती है, कहती, डैडी having a boyfriend and being in love are as far apart as अंधेरी स्टेशन and दादर स्टेशन. मैं एक्सप्लेनेशन मांगता हूँ तो कहती है, देखिए बोरीवली यानी ही इज माई फ्रेंड, अंधेरी यानी गाड़ी पहुंची है कि ही इज माई बॉयफ्रेंड, एंड दादर पर वी आर इन लव. मैं कहता हूँ कि फिर चर्च गेट पर तो शादी होनी है. वो कहती है, डैड आपको तो पता है दादर पर कई ऑप्शंस होते हैं. मुझे उस दिन का बिल्कुल इंतजार नहीं जब मेरी बेटी आकर मुझसे कहेगी, आई एम इन लव डैडी. और जब मैं पूछूंगा वेयर इज ही फ्रॉम, तो कहेगी www.facebook.com. डरता हूं मैं बेटी तू ये दिन भी दिखलाएगी. ब्राउज करेगी माउस से और अपना हाउस बनाएगी. नौजवान प्यार तो कर लेते हैं पर फिर डिसीजन मेकिंग के लिए कभी कभार हमारी एडवाइस लेने आते हैं। हमारी एडवाइस ये होती है कि बेटा शादी करने की तीव्र इच्छा से अगर दूर रहना है तो मन में लंबी सांस खींचकर 3 बार सासू माँ सासू माँ सासू माँ कहना है। फिर चाहे कतरीना तुम्हारे हाथ की लकीर बनना चाहे या आलिया तुम्हारे पांव की जंजीर बनना चाहे, तुम्हें दृढ़ रहना है, हर आक्रमण सहना है और कमजोर मौकों पर हर बार की तरह लंबी सांस खींचकर 3 बार सासू माँ कहना है। रांझा हारा, रोमियो मरा, देवदास जिंदगी से ऊब गया। उस एपिक लव स्टोरी टाइटैनिक का हीरो जैक देखो कैसे प्यार में डूब गया। चलो प्यार में मृत्यु दंड भी कभी कभार कबूल है, पर शादी करके उम्र कैद भुगतना ये तो बड़ी भूल है। और लड़कियों से कहता हूं कि बेटी, राधा और मीरा दोनों को तो सब पहचानते हैं, पर किशन की बीवी रुक्मिणी थी ये कितने जन जानते हैं। तो छोड़ो ये सब सोचना कि वेदर और नॉट आई शुड। सीधी सी बात है बच्चे, बैचलरहुड एंड स्पिनस्टरहुड इज गुड। Thank you very much for joining us for this second installment of 1 dose Gyaan 1 dose Muskaan. Await the third installment. Bye bye.